This is Sayeda Sabakatami. I'm gonna be do the abdominal test on my mom, but before I started to do, I wanna do the room checking. We are moving from this house. It's a little bit messy, but I'm still do it. So this is the oh, this is the chair I'm gonna be do. This is okay. Let me just turn it around. This is the floor, and again this is the chair, and up and down. Okay, so my patient is my mom. Before I'm starting to do the test, I'm just letting you know my mom is a little bit ticklish, so during the exam she might be like having a little bit uncomfortable. That was the reason. So hello, this is Sayeda Sabokatami.
Hello?
Hi, I'm gonna be your nurse today, so can I have your name and your date of birth, please?
Yes, please. I am Afaq Zamaradipur and my birthday is 21st June 1957.
Perfect. So when I'm recording this video, I'm gonna be save it and download it to the YouTube so my professor able to see it. Do you
Okay.
give me a consent? Are you okay if I do it this one?
Yes.
Perfect. Okay. Can you please lay flat for me? Thank you. So for the comfortable of the patient, so I'm gonna be put the pillow under the knee. Can you pull up? Awesome. Okay. So first things I'm gonna be do. So I'm gonna be check the inspector of the inspection. So what I'm gonna be look. So can I just move it this one, please? Thank you. So the contour. So my mom has a little bit like big belly, but what I'm seeing, so I'm gonna be expression as a flat contour. I don't see it any pulsation, any about the color. I don't see it any jaundice. Sclera also doesn't have any jaundice color, which is the yellow color. So I don't see it any wound, any tears, any tattoos, or any as I said, pulsation, or any abnormal skin tears or skin deformity. So for this matter, I'm gonna be use the sanitizer. So to sanitizer here. So sanitizer to clean my skin in my hand. So the other things I'm gonna be do. So when is the last time you go to the restroom for bowel movement, which is number 2? When was that? It's good. When was that? Is it this morning, last night?
This morning.
This morning. Perfect. Did you see any blood on it?
No.
Okay, perfect. The next things I'm gonna do, I'm gonna be auscultated. Auscultation usually started from right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. So I don't want to hear any abnormal in any quadrant. Or what I'm expecting to hear it's hearing between 5 to 34 bowel movement or hyperactivity in a minute. So that's what I'm expecting to see it from my mom. So I'm gonna be listening. Okay, right lower quadrant, right upper quadrant, right, left upper quadrant, left lower quadrant. In the clinical side, if you do not see any activities on the patient, what we're gonna be do, we're gonna be listening for the whole minutes. The next action I'm gonna be checking the aortic artery with the bell and diaphragm. I don't want it to hear it any brewing, which is the rupturing. We don't want it to hear it. That one. Listen it for the ball. With the diaphragm. Then I'm gonna be to the renal arteries. Listen to that. With the diaphragm, with the bell and diaphragm, with the bell on the left side, with the bell and diaphragm. Then iliac one. With the bell, with the diaphragm, with the bell, with the diaphragm. The next one, it's gonna be femoral. In the real side clinical, we're gonna be removing the pants of the patient, and we listen to the femoral arteries. But for the privacy, so I'm gonna be do over her pants and with the bell with the diaphragm, with the bell, and with the diaphragm. In all arteries, we don't want to hear it um, any rupturing, so, and any bruitings. So we can hear the pulsation, but no bruitings. Also, as I mentioned before, in his inspection, I couldn't see any pulsation on the patient. The next one I'm gonna be do, so I'm gonna be started to percussing, and then a palpation, and then percussing. Okay, so I'm gonna be started to do it. I'm sorry. So what I wanted to hear it, I don't want to hear it any dull. So which is on the left lower, on the right lower quadrant. If the patients have a feces, we might be hear it, but since the patient said to me she's went to the restroom, I should not be hear it. On the right upper quadrant, so we wanted to look on the edges of the liver. For that one, I can feel a dull, but no tympani is usually what it's no organs on it. And on the spleen, which is the left upper quadrant, we don't want it to hear it, and we don't want it when we percuss it percussion deeply, so we don't want it to feel it, which is, if we feel it, it means splenomegaly, which is the spleen is getting big. In a normal and healthy patient, we should not be feel it. For the liver also, when I'm going to the 12 ribs, and I'm going down, and from the nipple to the liver of my mom, so what I'm gonna be checking, or the patient, what I'm gonna be checking, I wanted to make sure the edge is no edgy, it's not like abnormal edge. And I'm gonna be I don't want to push it on her because I did it before, and I know she's gonna be uncomfortable, but in a patients, we're gonna be go really deep to touch the edge of the liver. And also the measurement usually should be tilted 12 centimeters, 6 to 12 centimeter. So I did it before for my mom, for my patient, my mom, so, and it was like a 10 for her. So I'm gonna be doing this one, so how I'm gonna be do, so this is the edge for her, and from the nipple to down, it's gonna be around here. So with the measurement, we can measure it. Again, I'm going to the left upper one, I don't feel it any dullness. Left lower one also as well. Another things about the bladder, so bladder, if it's a 300 to the 400 urine on it, so we are able to see it, we are able to feel it like a dull, but she went to the restroom before the exams is start, so I cannot hear the dullness. Then I'm gonna be light with light percussion. Do you feel it any pain?
No.
Okay, so we do it usually this one for the patient getting used to our hand. Then I'm gonna be go deeply. As I mentioned, I'm not gonna be do for my mom because I know she's gonna be so uncomfortable with that. But we do it as usually is 4 or 5 centimeter really deep. On that one, we should not be feeling any organs, so we touch it. Sorry. I try to not to. This is gonna be a deep one. Okay, and I did it. I don't feel it anything, and also I touch it on the left upper quadrant for the split. Another things is morphine. Morphine, we did it to find it if the patient has a cholecystomy. So usually if we touch it on the right upper quadrant, and we push it inside and try to grab at the liver, so patient should be feeling pain on that, which is I did it, and my patient, which is my mom, she didn't feel it pain on that. Okay, so I do this one is, can you please lay, not this side, please, on your right side. Okay, perfect. So can you put this one front, your knees front, please? Thank you so much. Okay, so no, this one should go. So on the lateral side, what I'm gonna be do, I want to again testing for splenomegaly or inflammation of the spleen. So what I'm gonna be do, I'm gonna be start to palpate to the lateral. Okay, and I, with the percussion, I still didn't feel it anything. Okay, can you go flat on your back one more time, please? Sorry about that. Another special test is for the appendicitis. So for the appendicitis, I'm gonna be push on the left lower quadrant, and I'm just leave it. If the patient, did you feel anything on your right side? Okay. In a real world, we do it also on the right side as well, but I asked, but usually if you didn't even ask and you did like that, so if the patient have appendicitis, patient should be feeling pain, and you will see the uncomfortable, or like you see a different expression on the patient's face. So which is when I push it, my mom didn't have that feeling, so which is showing she doesn't have the appendicitis. So I listened to the femoral. I didn't see any percussion. I palpated. And okay, I didn't see anything. Perfect. Can you please sit and sleep? Thank you. So I want you sit on the corner, like yes. So go a little bit forward. Go a little bit forward. Go forward. Forward. Yes. So another disease, CVA percust. So we do it on the back of the patient. Okay. So on the left and the right. Do you feel any pain when I push it? So this is gonna be the last exam I do on the patient. So if the patient's kidney have any inflammation, so we did that action, patient should be complain about the pain, which is my patient didn't complain about the pain. On this exam, I inspected, auscultated, I percuss, palpate to see if patient have any abnormality on the abdomen. Sometimes when we do it this one on the patients who didn't go to the bowel movement, or they have a gas in their abdomen, this kind of exams maybe be uncomfortable, but since my patient already have a regular bowel movement, patient doesn't have any issue on that. Okay, thank you so much, appreciate that.
Thank you.